Hi, I'm Ryan. I'm going to be performing a health assessment on a 6-month-old. His name is Barney. So before beginning the assessment, you want to enter the room, provide privacy, draw the curtain, perform hand hygiene, and then introduce yourself to the client and the client's parents. Hi, my name is Ryan. I'm a student nurse. I'm going to be performing a health assessment on Barney. So first you want to inspect, so you're going to inspect for any lumps, bumps, bruises, make sure that there's nothing that would warrant further investigation. Look for symmetry in facial expressions, symmetry of breathing. You want to inspect his conjunctiva, his nasal mucosa, oral mucosa. You would use an otoscope, look at the tympanic membrane. In infants and children, because of the positioning of the eustachian tube, ear infections are common, so you would want to make sure the tympanic membrane is not red and inflamed, which would be cause for infection. Next, you would want to check color, warmth, sensation. So color, he's purple, but for him that's normal. Warmth, he's warm. Sensation, because he can't verbalize sensation, you can stroke his cheek, see if he moves in that direction. Stroke the bottom of his foot, and this would be the Babinski reflex, and the toes would curl. Next, you would want to oscillate, so you can oscillate lung sounds. This is the same as with adults. You're looking for wheezes, rhonchi, crackles, stridor. You do both the anterior and posterior. Then you would oscillate for heart sounds. The only difference here is the position of the apex of the heart, which is medial to the midclavicular line at the fourth intercostal margin, which is just a little different than in the adult. The positioning of the apex changes as the child grows. Next, you want to palpate. So you can palpate the sutures of the skull. Make sure there's no fractures. You want to look at the anterior fontanelle, which is at the intersect between the coronal and sagittal sutures. It should be 5 centimeters in diameter at this point. If it's sunken, this can indicate dehydration. If it's protuberant, this could be hydrocephaly or increased intracranial pressure. Next, you want to palpate the bowel, make sure there's no obstructions in there. You would also want to also take the bowel sounds, 4 quadrants, same as with the adult. So with the 6-month-old, there's certain developmental progressions that occur. So at this point, Barney should be able to sit straight up with his balancing on his own. If you lean him to one side, he should be able to balance. To the other side, he should be able to balance. When you're bringing him off the ground, his head should come up first, which would indicate good head strength and neck strength. At this point, 6 months old, he should be able to roll over in either direction. You would want to make sure that he's tracking properly, so you have an object of interest, make sure that he follows it up and down. You would want to make a noise behind his head. He would respond to that noise in either direction. Check his peripheral vision, so bring an object of interest and he should move in that direction. At this point, you would also want to look at his psychosocial development. So he should be able to recognize certain faces. He'd be uncomfortable around strangers. He coos, makes noises, plays. At this point, he should also be able to bring things up to his mouth. There is no preference for right or left hand at this point, so both hands should be the same. And vitals for a 6-month-old. So heart rate is between 100 and 160. Respiratory rate is 30 to 60. And blood pressure is 45 to 65 over 65 to 90. And that should be it.